So the summary statement here is that fertility medications do not make new eggs. They don't create them. They don't suddenly make them appear. They only grow what is already present. What is an antral follicle? What's an antral follicle count? What determines how many eggs that we can extract in IVF? That's really kind of what is the important number. How many eggs can we get to work with to create embryos to help patients to become pregnant? There's a lot of confusion around these, and so I'm going to kind of break this down a little bit. So first of all, let's talk about what a follicle is. A follicle is an egg house. That's an easy way to think about it. There's one egg inside each follicle. A follicle is a structure that would have an egg inside of it. It's communicating with the egg, bidirectional kind of dialogue between the house and the resident, kind of nurturing the egg as it's getting ready to be released. At any given time, we have what we call a pool of follicles that are very close to being called up to ovulate. There's other follicles that are kind of deeper down in the tissue, and these ones that are kind of in the pool that are close to being potentially called up are ones we can see visually on ultrasound. So if you go to your fertility doctor and you have an ultrasound, they'll look at they'll look for these little black circles on your ovaries. Those are the actual follicles. Inside the follicles are eggs, one per follicle, and so if we do a count of all those black circles, that's called your antral follicle count. Okay, pretty straightforward. Now, your antral follicle count over years and decades slowly goes down over time. So in a given short period of time, say a couple months, you would do a few ultrasounds. Your pool, the number would be basically the same, should be plus minus 1 or 2 follicles, depends upon a few things, but pretty much steady. But over years, if you were to do ultrasounds, that pool would slowly go down. What we are doing is we're giving fertility medications to promote growth of as many of those follicles as possible. So let's back up for a second. In a normal cycle, out of the pool, one is the winner and becomes a dominant, what we call dominant follicle. So one grows. So it's all about growth. So an antral follicle pool will respond to these fertility medications, and a high number of them will grow, probably about 50 or 60%. Not all of them, but a high proportion will. And that's what we can expect to get in terms of a yield. If we do IVF, this is how many we can get. So when we have a situation where patients are sometimes confusing what the fertility medications are doing, they're often confusing that they're somehow making eggs appear. That is a misunderstanding. I can only have so many as were there to start with. If a patient tells me I got 11 eggs retrieved, I know that they had more than 11 follicles to start with, because as I said earlier, it's never 100%. We don't get them all to grow. We'll usually get half. So she probably had 15 or even 20 antral follicles to grow to start with, and then a certain proportion grew from that. On the converse, if someone has 7 antral follicles to start with, I know that I will not get more than 7 eggs out because they won't all grow. In best case scenario is we get 100% to grow, and that's likely not going to happen. But we will only get as many as we have. So the summary statement here is that fertility medications do not make new eggs. They don't create them. They don't suddenly make them appear. They only grow what is already present at the beginning of a stimulation cycle.